of tests. But Sean, it wasn't meant for millions of people like we're talking about. It was a bad system for millions of people. It was okay, the CDC. It was okay for small numbers, but we're talking about something that hasn't been seen for many, many years. This hasn't been seen for decades. I don't know, maybe, the big one was 1917, and that was the worst by far. That was that was the Spanish flu, they call it. And there was really nothing like that. What that did to Europe, that wiped out vast sections of Europe, and a big chunk of the United States too. That was the worst.
Yeah, you've been asked a lot of questions in recent days about the Defense Production Act. Why I'm saying this, I do think that, bad times often brings out the worst in a few. The price gougers, the hoarders. With all due respect, the Democrats playing games and holding up this bill for a week really ticked me off. You were more gracious than me, but I'll put that aside for a minute. But all these businesses that are going to scroll on the screen have stepped up and offered to help, and you said that you have not had to enforce the Defense Production Act except for two minor cases. You didn't want to talk about it earlier today. Explain, and we'll keep these companies that are helping the American people, explain this new paradigm of public and private partnerships and drive-up testing and everything that they're doing.
Well, there's a tremendous esprit de corps. It's like incredible what's going on. The spirit, the love of our country, and we have something called the Defense Production Act, and it's a very powerful act. It's incredibly. I mean, you can do almost anything as president. You can demand that they give you whatever you want. I mean, all of these things. It's a powerful tool. So I haven't had to use it because, like, we had Ford step up, General Motors step up, 3M step up. So many companies stepped up, and they're making vast amounts of things. But, when you talk about ventilators, that's sort of like buying a car. It's very expensive. It's a very intricate piece of equipment. You know what it is. Heavily computerized, and, the good ones are very, very expensive. And, they'd say, like Governor Cuomo and others, that say we want, 30,000 of them. 30. Think of this. You go to hospitals, they'll have one in a hospital. And now all of a sudden everybody's asking for these vast numbers. So, but we have now companies stepping up, and they're building them. They're doing the masks. We've already delivered millions and millions of masks. But remember, we're really a second line of attack. The first line of attack is supposed to be the hospitals and the local government and the states themselves. I mean, we have people like Governor Inslee. He should be doing more. He shouldn't be relying on the federal government. Governor Inslee, that's the state of Washington. He was a failed presidential candidate, and, he's always complaining. And your governor of Michigan, I mean, she's not stepping up. I don't know if she knows what's going on, but all she does is sit there and blame the federal government. She doesn't get it done, and we send her a lot. Now she wants a declaration of emergency, and, we'll have to make a decision on that. But Michigan is a very important state. I love the people of Michigan, what they do. I'm the one, I'm bringing back many, many car factories into Michigan, and she is a new governor, and it's not been pleasant. And, you look around and you see what's going on. And by the way, most governors have been fantastic, I have to tell you. Most of them, whether it's Democrat or Republican. But we've really had some trouble with the state of Washington. The governor, he ran for president, didn't exactly do well. He got 0. And we've had a big problem with a woman governor from, who I'm talking about, from Michigan. So we can't, we don't like to see the complaints. And I am getting along with Governor Cuomo. I think that a lot of things are being said that are more. I don't think that certain things will materialize. And, a lot of equipment's being asked for that I don't think they'll need. But I'm building, we're building 4 hospitals, 4 medical centers, and many other things. We've developed and sent thousands of ventilators. And hopefully they're going to do well. But, you have to understand, this has to be managed by local government and by the governors. It can't be managed by the federal government. With that being said, we inherited a largely empty, you'd call it a chain, or to just think of it as a big monster warehouses all over the country. But it was largely, again, it was a broken chain. And we're filling it up, and we fill it up very strongly. And we deliver the equipment. A lot of the times we have them go directly to the states. So we're really helping the governors. We had a call today where almost every governor, just about, I would say all 50, just about, and it was like a love fest. They were so happy with the job we're doing. But they are that front attack because they're there. Now, in the case of New York, in the case of Louisiana, where you have a very good governor, John Bel Edwards, but he's a Democrat, and he's very thankful for what we're doing. We're doing a hospital for him. We're building, these are sort of portable hospitals, but they're incredible. I mean, when you see them go up. And it's FEMA, and it's the Army Corps of Engineers, and they are incredible people. They can't get enough credit for the job they're doing.
Yeah, well, and I was kind of angry at Andrew Cuomo. I had him on radio for 40 minutes. Great conversation. I grew up, I was born and raised in New York. And then it's, I need 30,000 ventilators. And I'm like, okay, it really was annoying me. Before I get to the things I don't like in last night's bill, and a lot of it got taken out, thankfully, but I want to, and rather than reading everything that's in it, I'm going to scroll. I love lists, you know that. The good things in the bill, good in the sense that we're going to help hospital workers, we're going to help workers, we're going to help small business, we're going to help the cruise line industry, the airline industry. Tell us what you like about this. It's unprecedented. We've never spent this kind of money before.
Well, as an example, the workers are going to get $3,000 for a family of four. They're going to get all sorts of things that they, frankly, in many cases, they wouldn't have even gotten if they had the job, if we didn't have to go through this hell. And it's a wonderful thing. The problem is, and you see it all right there, it's right in front. The problem we have is that it's very, very painful dealing with the Democrats because they ask for things that they've been trying to get for 10 years that we don't want to give, but if we don't get them or give it, we don't get the $2 trillion that gets sent out to people, the workers, and we don't get the $2 trillion that's going to really save companies. We have a lot of this money is going to save Boeing, it's going to save the airline industry, and, you know, that means not only does it mean what it says, it also it means tremendous jobs. We can't let Boeing go. You know, Boeing had a problem, big one, to start off with. Then on top of it, this happened, and we'll save Boeing, and we'll save the airlines, and we'll save other companies. We have companies that were virtually AAA, and all of a sudden you're loaning them money. You could call it a bridge loan, a short loan to get over it. In all cases, we intend getting the money back, getting interest, and in many cases, some cases, issuing what they call warrants will get pieces of the company, large pieces of the company, and that will come back and inure to the benefit of U.S. taxpayers. I mean, they're going to be great. It's a great thing. So we had to give up things that, you know, instead of just saying, let's do what's right, which is taking care of the workers and making sure these companies don't go out of business, you could never start them again if the airlines leave. You're never going to be able to start. It's like, it's a very difficult thing with the Democrats. So we end up giving them something for Kennedy Center. We end up giving them something for far worse than that. Look, say what you want about Kennedy Center.
I'll scroll that. I'm going to put...
Because, you know, the Kennedy Center got hit hard. I mean, there aren't too many people watching. I said today, Romeo and Juliet, okay? You know, right. You can't pretty much go in because of what's gone on with the virus. But far beyond Kennedy Center, we give things that we don't want to give. You know what I'm talking about. You have them up on your screen. But you have to in order to get. We cut out, and you just said it better than anybody, over the last 2 days, we cut out much of it. If you would have seen some of the things we were giving up, and it's a shame that we can't just sit down and easily, it's always like such a big deal. I mean, it went on and on and on late into the night, every night, and this could have been done quickly in one day. The bottom line is we got a 96-0 vote, and I think all of the senators that weren't there were in quarantine. And the case of Rand Paul, a good guy, by the way, he actually has this problem, and I'm sure he'll be all right. I spoke to him today.
That's good news for Senator. And by the way, people are saying you were joking about Mitt Romney. You want everybody to get well. I'm assuming. I didn't even know you did.
Well, I'm not a fan of Mitt Romney. I know
I'm not either.
Understand Mitt Romney. I'm not a fan, but of course I want him to get well. Absolutely.
Yeah, we do. All right, let me ask you this, and I scrolled the bad stuff. I'm more angry than you are, but that's it's more important we focus on the solutions. So we look at the unemployment claims today. The number's scary. I mean, 3.3 million. It's not surprising, but it's scary. We've watched, as I mentioned earlier, China, South Korea. You get quickly all scary, scary numbers. People contracting the disease. Scary, scary numbers with all sorts of things. And all of a sudden, if the pattern holds, then it levels, and then it drops down completely, and then there's no more new cases. Are your doctors telling you every day they expect that to happen here?
Well, I think we do. I mean, whether you're doctors or not, I'm looking forward to that day when it levels out and then goes down. And I think we're going to have a tremendous bounce. Look at the stock market today. I think we set a 3-day record. We set a 1-day record yesterday. Today we almost set it again. I mean, the stock market's gone up tremendously over the last few days. And I think it's for two reasons, because they know that I am one that wants to get everybody back working. That was important. People were saying, we'll take 3 or 4 or 5 months. And everybody said 3 or 4 months. Our country is not designed for that. And our people aren't designed. We're not engineered for that, Sean. Everybody wants to go back to work. So, people, they own a restaurant. They can't keep their restaurant closed for months. By the way, the sooner we go back, the better the lift that we're going to get. I think we're going to have a bounce like maybe you've never seen. I just think there's so much pent-up demand. But we have to get rid of this. Now, there's a possibility I'll do it in quadrants, in pieces. And
Can you explain that?
You'll take the Farm Belt. You'll take certain states that aren't badly impacted, where they have almost none or they have just a little bit. You take a look, some of these great states in like Iowa, you take a look at Idaho, and you take a look at Nebraska, where they have a great medical facility, by the way, even for this. And you take a look at some states, a big portion, I mean, they all have a little bit, but many of them have just a little bit, and they have it under control. They're incredible governors, they're incredible senators, and they're watching it, and they're very, very well run, and they have it under control. They immediately put the people in quarantine. So, so you do that. New York is a bigger deal, but it's going to go also. But I have a feeling that a lot of the numbers that are being said in some areas are just bigger than they're going to be. I don't believe you need 40,000 or 30,000 ventilators. You go into major hospitals sometimes, they'll have 2 ventilators, and now all of a sudden they're saying, can we order 30,000 ventilators? So, look, it's a very bad situation. We haven't seen anything like it. But the end result is we got to get back to work, and I think we can start by opening up certain parts of the country, Farm Belt, certain parts of the Midwest, other places. But I think that, as an example, you go to Texas. There are places in Texas, great governor, Greg Abbott, there are places in Texas where, it's a tremendously big state that aren't impacted by this. So I think we can open up sections, quadrants, and then just keep them going until the whole country is opened up. But we have to open up. The people want to get back to work. They want to get back. That's the way we're engineered.
Let me go back to Governor Cuomo when you said, I really did have it for the first time he's ever done any of my show. We had a good 40 minutes on the air, and I think he's been, in many ways, he's done a good job in New York, but then he always reverts back to whatever. I'll put up on the screen all the things you did for New York, and there's one thing that I notice, and I don't know, maybe this is uniquely you, but I don't think people really truly understand, where do you think we would have been if the travel ban wasn't in effect? Where would we have been if 10 days after the first case? I think that one decision was probably the best from the beginning, but I don't hear anybody on the other side of the aisle say, I don't like Donald Trump, but that was a smart idea. Probably not only bought us time, probably saved tens of thousands of Americans from contracting the disease. That was a good call. I mean, are we that divided as a country you can't acknowledge where you kill Soleimani? You can't acknowledge killing Soleimani, leading state sponsor of terror, Iran. He leads the state sponsor of terror. He killed Americans in Iraq. The divide is pretty intense.
Well, you don't hear it too much. You'll hear it from Republicans. You'll hear it from some Democrats. But no, we would have had tremendous death had we not acted early. And our country's getting great credit for that. Forget me. Our country is getting great, but it was a good decision. Hey, when I made it, I was saying that's a big decision. You cut off China and the people coming in, and you're talking about tens of thousands of people. No, we would have had death all over the place, Sean. You know that.
Let me go. Early on, I remember somebody asked a question about how your younger son. I know your family. I know your older kids. I've met your younger son. He's a wonderful kid. Very polite, nice, funny, smart. And you said you asked, what are you telling him about it? And you said it's bad. Where's he now? How does he feel about it? And what do you say to those Americans that they see the headlines, they read the worst of the worst? You got death counts on TV almost 24/7, or contracting the disease. What do you say to Americans that are very, very concerned, worried, even fearful about this?
Well, as anybody that's a parent knows, he's a wonderful young boy, and I have wonderful kids, but the others are old enough they can see, and they can see for themselves. But it's very hard talking about a thing like this because it's so negative. It's so it's death, and you don't like discussing it, and you hope they can always handle it in some way. But people they grow up and nobody sees this. There's not been anything like this in this country. Now, swine flu was pretty bad, but it wasn't to the extent of this. I think you probably have to go back a long ways to go to this one. Who would think when I've read about the Spanish flu, that was 1917, which killed anywhere from, they say, 75 to 100 million people. And it was devastating. And it was also, if you had it, you had a very good percentage of not making it. It was really something. Now, one thing that I can say that's really good, the mortality rate is much, much better in our way than people were thinking at the beginning, because you were hearing 3, 4, 5%. And now, with all of the testing and all of the things, and we've now established great testing. That's one thing I can also tell you. That's really a big achievement. We've tested now more than anybody. But with all of the testing, with all of the cases, we're now, and you have to remember, if somebody's sick, they're going to the doctor, therefore it gets reported, bad things can happen to that person. But there are thousands and thousands of people, hundreds of thousands of people, millions, where they have it, and they don't go to a doctor because it's not that bad. They have a cold, they have the sniffles. In some cases, they have nothing. They have it, but they literally don't have anything. So when you look at that, and then you see the people who die, you take a look at the people, I think you're talking about very significantly under 1%. And I think that's a tremendous thing. Now, the flu, we lose, thousands of people a year to the flu. But that number is very, very much under 1%. It's, 1/10 of 1%. So this number would be higher. But I think that's a big positive, because when this started, people were talking about 3, 4, and 5%. Now they're seeing that, and it's through the testing, but they're seeing that it looks like it's substantially below. I think it's substantially below 1%, because the people don't report. The only people that report are the people that are really feeling sick. And those are the ones that, unfortunately, sometimes don't make it.
Let me ask you, 222 days, Mr. President, there will be an election in this country. It looks like it will be Joe Biden on the other side. I'm not sure if you've had an opportunity to watch his, let's say, technically struggling candidate, struggling whatever he's doing. Today he said, "We hold these truths, etc." That's after, of course, we hold these truths to be self-evident. All men and women are created by the thing. Are you watching it? And what is your analysis of the things he's saying? And seems to be rather forgetful and doesn't seem to have a lot of stamina and doesn't seem to be, I say it on this show, I say he doesn't seem to have a fastball if he ever had one, and his slow pitch seems to be slower than ever.
Well, I understand what you're saying, but to be honest, I watched his debate. I'll shock you by saying this, right? I watched him debating Bernie, and it was pretty much of an even debate. He was not bad at all. And, Bernie is not a bad debater. He's in there. He's got a lot of ranting and raving and, let's give everything away. But Bernie is not a bad debater. He's been a pretty good debater over the years, Bernie, and I thought that was one of his best nights. So I don't want to really say negative. Look, I'd rather just run against him. I think I want to run on my record. I don't want to go against somebody else, and we'll see what happens. He's still got. That's a long time, before you get there. That'll be quite a bit of time. We're going to have our convention. We have our convention in North Carolina in Charlotte, and we are, definitely planning. It's toward the end of August. And somebody was asking today, will you cancel the convention? I said, no way I'm going to cancel the convention. We're not going to cancel. It's going to be incredible. And I don't know what the Democrats are doing. The advantage is the winner gets to choose the time of the convention. So I could go first or I could go last. Going last is much better because when you go first and then they do it, so going last is much better. And we chose the second date. So we're quite a bit later than them, which I think is good. So we're at the end of August, and I think we're going to be in great shape long before there. Then I don't know what they're going to do. They come up sooner. They're in Milwaukee, a great place. So if they don't do it, maybe I'll do a speech there or something. We'll do a rally in Milwaukee where they were going to be. But they announced today, I think it's maybe unlikely that they're going to do a convention, but that's up to them.
You said that you will be speaking tonight, a half hour after this program, 10:30 Eastern, 7:30 Pacific, with President Xi of China. We know that this now is a fact. It's indisputable. They hid it. They lied about it. Mike Pompeo said China is still not being forthcoming. He even went further. He also said Russia's not being forthcoming. And Iran, we know the conspiracy theory that they've been pushing in not being forthcoming. He even went further. He also said Russia's not being forthcoming. And Iran, we know the conspiracy theory that they've been pushing in China against the United States. I know you've said at different times you get along with President Xi. You have this new first part of this trade deal, $220 billion in 2 years. What are you going to say about him and withholding information and moving forward? Why did they lie to us?
Well, let's go back. First of all, you mentioned Russia. Russia's looking like they're having quite a bit of a problem, and people weren't bringing that up with the whole thing with the virus. Iran, we know about that. That's been really, really bad. And we've offered them assistance. We have the greatest in the world. We have the greatest people at this kind of thing in the world. And with China, they said that some of our soldiers caused the problem. We're saying, what soldiers? What are you talking about? It wasn't by him, I don't believe. But nevertheless, it got out there, and I started calling it the Chinese virus. And everybody picked it up. And, I'm not looking to do that. Look, it's better to have a good relationship. We have a great trade deal now, finally, after many, many years. Should have been done by Obama and, by the way, previous administrations, because nobody has ripped this country like China. We were losing more than that, $550 billion a year, every year to China. And this went back many, many years. So we now have a great piece of the trade deal. Now we'll start phase 2, and that'll be great too. And we're taking in billions and billions of dollars a year in tariffs. And they're paying for it because they devalued their currency and other things. Mm-hmm. So, let's get along with China. Let's get along with Russia. If we can, we'll see if we can do something with Iran. We'll see. I mean, I think they want to make a deal. I think if they don't, they got a problem. But we'll see what happens. When President Obama made that deal, it was one of the worst deals I've ever seen. You
would help Iran if they would allow help with the virus. Secretary of State Pompeo said that.
We've offered many countries, including North Korea, including Iran, I think it's the appropriate thing to do. And we'll see what happens. Look, we're going to see what happens with Iran, and I think they want to meet. Mm-hmm. I think they want to make a deal. I think John Kerry shouldn't have been speaking. That's called the violation of the Logan Act. But John Kerry has been speaking to him, probably saying, wait till after the election. Maybe you'll be dealing with Sleepy Joe, and you can make any deal you want. Same thing with China. Maybe China's saying, look, let's wait till the election's over, and maybe we'll be dealing with a guy whose son walked out with $1.5 billion to manage.
Can I ask you, there's been a lot of speculation. I watch your entire medical team during the task force meetings. Dr. Fauci, I think, has served 6 presidents. You have some of the best. Is there a conflict? I'll ask you, with either Dr. Fauci or anybody else.
No, I get along with him great. I get along with Deborah fantastically. I get along with. Look, we're all in this together. This is not a question of that. And I get along with most of the governors. I don't like it, though, when some governors, I mean, I mentioned two of them, but some of these governors, they take, and then they complain. They take, and you do a great job. You build them a hospital. You do other than that, they're always complaining. So I don't like that. But generally speaking, I get along. I'm getting along actually very well with Governor Cuomo. We have a boat, we have a ship going there, and it was supposed to be in 4 weeks. It's leaving now on Saturday. We were able to move it up. It's stocked up with supplies. It's a great ship, and it's a hospital ship, and it's leaving Virginia on Saturday. And it's very exciting. It's going to get to New York on Monday. It's going to be docked in New York Harbor, and these are tremendous. They're warships. These are ships that take care of the soldiers at battles, and they are big and powerful. And it'll be up there, instead of in 3 weeks, it'll be up there on Monday.
How are the people that are around you, and you see people kind of spread out on the stage, and we have a little less than a minute here, and the First Lady in particular, I think she could say almost on a regular basis that her approval ratings are higher than yours. Is that a problem in the family?
I think they are. She's doing a great job. People love her. Every time I make a speech or have a rally, they have sons. We love our First Lady. Now, she's doing a fantastic job, Sean. You know that.
Yeah. Well, I know, Mr. President, I know you've been busy. I know it's up late. I know you've been working hard. My goal is that every American, we want to save lives in the interim. We want to get a permanent solution. Thank you for taking the time to spend with our audience, and hopefully we can get this past us as quickly as possible. Thank you, sir.
It's an honor. Thank you very much, Sean. Thank you.
All right. Thank you, Mr. President. One of the things I love about this country is that we have the greatest scientists. Look at all those companies that are helping, all hands on deck. The 90% that is great, and then you get a few bad apples like what we saw in Congress, etc. Anyway, unfortunately, that's all the time we have left. Let not your heart be troubled. Laura Ingraham.
2 seconds, 3 seconds, 4 seconds, 5 seconds.
Well, no, they were telling me to stretch. They told me they didn't have the control room switch, so I was doing it for them.
No, let me just say this.
Oh, I had it peeked out.
You have blown the brake and that clock. I think 3 nights in a row, right, MP? Like 3 nights in a row, yeah. So, and I know you're talking to the president, but
last night we had the big deal.
I mean, Hannity, I think at the end, you were going to start asking questions about what's your favorite color.
You ran out of questions. Andrew Cuomo and De Blasio whining. And you give the state of New York everything. I'm like, how about saying thank you to the country, thank you, Mr. President.
Politics, Hannity. You've been doing this for 25, 30 years. You know, this is all politics,
It's a national emergency. Maybe put it aside for 10 seconds. Let's just stick together here.
I enjoyed listening to the interview, Hannity. We're jammed tonight, and have a good rest of the night. We'll talk to you tomorrow.
Have a great show, Laura, as always.
All right, I'm Laura Ingraham. This is the Ingraham Angle from Washington tonight. While President Trump tries to bring hope, and as he just did on Hannity's show, of course, the American people, the left, is focused still on stoking fear, and it's always the worst-case scenario. We have our own panel of experts, of doctors, practicing physicians, including those who are treating COVID patients, here to explain why you should not panic. And you won't believe what the Queen of San Francisco tried to sneak into the coronavirus.
To act more urgently, and then answering questions with specifics about what he's doing, because they're actually doing the work and getting it done and leaning forward and trying to do as much of it as possible. Just the contrast with everything else going on in the federal government, even though he has nothing but kind words to say about anybody else in the federal government. Don't put any of my politics on him at all. But the contrast between hearing him talk about getting this stuff done and the excuses and defensiveness and, nonsense, frankly, that you're hearing from the rest of the federal government, from the administration and their response, I finally feel like there's something going on federally that we should all be paying attention to and hoping for its success and counting on. And it meant a lot to me that he made time to be here.
Rachel, next time, if he has more to say and you run out of time, just leave him in the chair. I'll do the whole hour with him.
I will do.
Thank you, Rachel.
Thanks,
Thank you very much. Well, Laura Dean stopped wearing her wedding ring at the beginning of this month because she was afraid of what might be on it when she came home from work. Laura Dean is an emergency room physician in Boston, which today reported 150 healthcare workers infected with the coronavirus. Laura Dean will join us at the end of this hour, and she will tell you her story. Last night, we brought you the then breaking news report in the New York Times about the surge in coronavirus deaths at Elmhurst Hospital in the borough of Queens in New York. Tonight, we'll be joined by the reporter who went to that hospital and talked to the people waiting in line all day, day after day, in the hope of being tested for the coronavirus. And Dr. Zeke Emanuel will join us. He's a veteran of the Clinton administration and the Obama administration. We will get his reaction to the president's suggestion that America should be ready to reopen for business by Easter Sunday. And Senator Amy Klobuchar will also join us later in this hour. She is one of the 96 senators who voted yes on the emergency economic aid bill passed by the Senate, with no one voting against it. Senator Klobuchar's husband has been hospitalized with coronavirus, and she has some good news to share tonight about his progress. We begin tonight, as we always do, with the numbers. As of today, the United States has 82,849 reported cases of coronavirus and 1,177 reported deaths from coronavirus. That is more reported cases than any other country in the world, including China and Italy. And on the day when the United States broke this terrible record, it is worth remembering that exactly 1 month ago, Donald Trump said that the opposite would happen. Donald Trump said 1 month ago that as of now, we would have 0 cases.
When you have 15 people, and the 15 within a couple of days is going to be down to close to 0, that's a pretty good job we've done.
Don't ever forget that he said that. Today, Donald Trump said his administration is working on a data analysis that will allow them to change their recommendation on social distancing and other coronavirus precautions from a national recommendation down to a county-by-county basis. Now, it is hard to think of a less relevant measure for public health than the utterly irrational and archaic boundaries of counties in the United States. Most Americans can't tell you what county they are in right now, what county they live in. Still, the president said today that possibly next week, his so-called coronavirus task force will offer guidelines categorizing counties in America as high risk, medium risk, or low risk. There are vast tracts of America that are virtually empty of people, but they are counties. Those big empty spaces are counties. And so Donald Trump will probably get to rate some of those empty counties as low risk and then claim some kind of victory in urging the reopening of American business in, say, Inyo County in California, which is the second biggest county in California by land mass. Over 10,000 square miles. And it has only 18,000 people living there, which means that each person in that county has at least half of a square mile per person for social distancing. Los Angeles County is less than half the actual physical size of Inyo County, and it has 10.1 million people. What possible relationship do those counties have to each other? By choosing counties, Donald Trump has chosen the geographic marker that he believes will allow him to tell some people in America that they are at low risk. The shutdown of most of the American economy produced the biggest one-week surge in applications for unemployment benefits in history. That news came out today. 3.3 million Americans applied for unemployment insurance last week. Many, many more have lost their jobs but don't qualify for unemployment benefits or have not applied for those benefits yet. So the real number is much, much bigger than 3.3 million. The president who predicted we were going to be at 0 coronavirus cases at this point, which would also mean 0 unemployment filings based on the coronavirus, told this lie today.
This was something that nobody has ever thought could happen to this country. I'm not even blaming. Look, we inherited a broken situation, but I don't totally blame the people that were before me in this administration. Nobody would have ever thought a thing like this could have happened.
all the professionals thought a thing like this could happen, all of them. And in fact, the Obama administration left a pandemic playbook for the Trump administration to use precisely for the situation this country is in tonight. Politico reports the Trump administration was briefed on the playbook's existence in 2017, said 4 former officials, but 2 cautioned that it never went through a full National Security Council-led interagency process to be approved as Trump administration strategy. The playbook was designed so there wasn't piecemeal thinking when trying to fight the next public health battle, said one former official who contributed to the playbook. Leading off our discussion tonight is Dr. Erwin Redlener, the director of the National Center for Disaster Preparedness at Columbia University. He's an MSNBC public health analyst. And Nicholas Kristof is with us. He's a Pulitzer Prize-winning columnist for the New York Times. He has been interviewing epidemiologists about the coronavirus, doing important reporting on that. Dr. Redlener, when the president said again today, no one could have possibly imagined a situation like this ever coming to the United States. What was your reaction to that?
Well, having been very much involved with the development of such plans back in 2007, 2008, on a federal, state, and local level, it's a preposterous statement, has no bearing to reality, but, why are we surprised? I think the key thing is that we continue to get these mixed messages based on ignorance, a lack of understanding of the science, and just a complete misunderstanding of what the message should be to Americans. The problem is he's using that kind of information to justify in some way or explain the incompetencies of what this administration has been doing or not doing in preparation for something that we knew was coming. And even when we got the early warnings, we still messed up the entire process of getting the appropriate testing done and distributed properly. And now we have mixed messages which are just confusing states and localities. And the biggest problem of all, of course, is a complete active melting down of America's health and hospital system. It is staggering in its breadth and scope of incompetence. And, the president did not cause this virus to develop. The president is responsible for leading the country in the wrong direction with misinformation. That has been extremely destructive to our efforts to combat this calamity that we have on our doorstep.
Nick Kristof, as you've been talking to the experts and reporting on this in the New York Times, have you found anyone who said that, who's an expert in this arena, who said they are completely shocked by this happening in the United States? They never dreamed something like this could happen.
No, of course it's the opposite. And, I will back up what Erwin said. I've known him for many years, and he's been hounding me, as many other journalists indeed, to write about this risk, as have other epidemiologists, as have other national security people. This is a risk that we're all aware of, and we've also known the importance of getting personal protective equipment, PPE, in the hands of doctors and hospitals. We've known the importance of getting ventilators. I began writing about this in January when Wuhan was hit, and China gave us a 2-month warning that we squandered. And now I'm afraid New York City is turning into Wuhan.
Dr. Redlener, what was your reaction to the president saying that the task force is going to come up with a county by county ranking of risk from low risk to medium risk to high risk?
It is jaw-dropping, Lawrence. I just can't imagine who advised him that, and I'd be very disappointed to hear that one of our really great professionals that are in the agencies that are responsible for dealing with this actually has been advised that. It makes no sense whatsoever. I mean, among the things, in addition to what you were saying earlier, which of course make total sense, the virus is not aware of a map of the United States counties and how it's going to behave in County X versus the county next door. The whole thing is just fraught with inaccuracies and really contrary to what the professionals that he has theoretically around him are actually saying. I've never seen, I don't think anyone has seen this level of conflict and complete disparity between what the scientists and experts are saying and what the administration is saying, completely like they're in a different universe here. And I know Nick has been reporting on this intensely and appropriately. And I don't know who's listening to us exactly, but it's not seeping up. We should have been having a national policy recommendation a long time ago, so we wouldn't have governors and mayors struggling to improvise on their own. There's one state's doing this, another state's doing that, and part of that's just the responsibility of completely faulty improvised messaging that's coming from the White House. It's a shame, and I'm shocked. But there you go. Now we have to deal with it, and the main thing we have to do right now is make sure we save the lives, literally, of the doctors, nurses, aides, attendants, registrars, technicians that are struggling every day. They're basically going, Lawrence, into a war zone. And 2 combat veterans told me it's exactly that this analogy is not hyperbole. This is what it is. I have a son who's an ER doctor in New York, and we are worried sick every single day that he and all of his comrades and workers in all the hospitals and all the places where this has been an outrageous, intense outbreak, we fear for them, and we should be protecting them. Nothing could be more important than that. Otherwise, the entire healthcare system will, sooner rather than later, collapse. We're worried about that anyway.
Dr. Red Leonard, let me assure you that millions and millions of Americans are listening to you, and we have the proof of that in the latest polling on this. A poll question coming out today saying, should Americans continue to socially distance even if the economy is damaged? And 81% say yes. 81% agree with you, Dr. Red Leonard. 8% say no. And Nick Kristof, that poll is a very, very encouraging poll in a country where the President of the United States gives everyone misinformation every day.
Yeah, and, in fact, look, I mean, obviously there are frustrations in parts of the country. People are worried about being laid off. There is some evidence that the downturn, that their joblessness rates may actually become greater than they were at the peak of the Great Depression, according to the St. Louis Fed. But the evidence is that what damages the economy is not these public health measures, but is rather the virus itself. And so the way to protect the economy is simply to protect the population, and that does involve social distancing measures. That was a kind of basic point that epidemiologists were making to me. With the help of 2 epidemiologists and a colleague, we developed a model for the coronavirus, and it showed that if you compare that a 2-week intervention and then lifting it would lead, with certain assumptions, to more than 120 million infections in the U.S., a 2-month intervention would lead to 12 million. So, there are trade-offs there. Where the country chooses to decide to go will depend in part on the course of the epidemic. I do think, in response to your question earlier, Erwin, that what the administration is talking about in terms of classifying different parts of the country is what some epidemiologists have suggested in terms of, if you had enough testing out there to determine that there were some places where community transmission was not occurring, then you might, in those places, be able to send kids back to school, etc. The problem is that right now, we don't have that testing capacity. We have no idea where community transmission is occurring. Down the road, if we have more testing, if we have more data, we can make smarter decisions about where to ease curbs and where not to.
Of course, Nick is, of course, totally right, Lawrence. But and the other thing, and he's right about the economy versus the public's health. But that's the whole point of having this gigantic appropriations, to help people get through this without actually being afraid of being able to pay their rent and buy food and all that stuff. And that was the whole point. We have to deal with the economy, but we can't do it at the expense of the public's health. Just doesn't make any sense at all. And point about the data, yeah, if we had the data, if we had the testing that we should have been doing for many months now, we would be in a position to make much more fine-tuned, nuanced predictions, but that's not where we are.
Dr. Erwin Rendlener and Nicholas Kristof, thank you both for starting us off tonight. We really appreciate it.
Our pleasure.
And when we come back, Dr. Zeke Emanuel will join us. He said this week in the New York Times that America is losing the war against COVID-19, but he believes there is a way to turn that around. Zeke Emanuel joins us next.
To be honest, a little dust, it never bothered me.
Results with hydroxy and Zithro? This is insane.
You know, one of the things that would actually be a very good idea is that in this emergency,